Good morning, everyone. My name is Dr. Archana Basu. I'm a research associate at Harvard Chan and a clinical psychologist at Mass General Hospital. Welcome on behalf of Dr. Karestan Koenen and her team to this ongoing series of virtual forums on coping with COVID-19. Today is our fourth session entitled How the Discomfort of Grief Can Help Us, Recognizing and Adapting to Loss During the COVID-19 Outbreak. Just to do a quick check, can people hear me? Okay, great. All right. As with prior forums, our presentation will be followed by a 15 to 20-minute discussion and Q&A period. Please use the Q&A box to ask questions or make comments. This presentation is being recorded. The presentation, along with any resources that are mentioned, will be available through the Harvard Chan website. With that, I'd like to introduce our two speakers for today. We are truly honored to welcome Dr. Katherine Shear, Marion Kenworthy Professor of Psychiatry at Columbia School of Social Work and Columbia College of Physicians and Surgeons. She's the founder and director of the Center for Complicated Grief. She's the developer of complicated grief therapy and has been conducting research and supporting individuals through issues of grief and bereavement for over 30 years now. She's joined today by Dr. Christy Denckla, research associate at Harvard Chan. Dr. Denckla will get us started on the presentation.
Thank you, Archana, for the introduction. I am Christy Denckla, and I will be introducing. So I'll be introducing the setting the stage a bit for some of what Dr. Shear will go into for more detail. So for the next 10 minutes, I'm going to set the stage a little bit for coping with COVID-19. And law in the context of the loss and grief that we are all confronting on a global scale. I'll talk about some of the risk factors associated with adverse outcomes, and then I'll also talk about some of the protective factors. And then Dr. Shear will take over for the second half for the next 20 to 25 minutes, introducing an evidence-based framework for understanding COVID-19 loss and grief. And then we'll open the forum up to questions and discussion. So losses are ubiquitous in a world that has been closed down by the virus. Jobs have been lost, the economy has shut down, usual graduations and celebrations have been canceled. Schools have been closed, leaving families not only homeschooling, but also losing childcare. Sporting events have been canceled, artistic performances, holidays, celebrations. These are all sort of generating a landscape of compounded losses. And among that landscape, some of the most painful and impactful of the losses we're facing are the losses and deaths of loved ones. This is a screenshot from the Hopkins COVID-19 Resource Center from last night. By now, these numbers have changed as we are seeing on a daily basis. But the scope of this loss is truly global and unprecedented. And as for example, in New York, which is tragically the epicenter of these COVID deaths right now, the losses compound. The death of those we love is impacting everyone by either 1 or 2 degrees of separation. So if there is any silver lining in all of this, it is that grief is a common human experience, and for millennia, we have an innate capacity to adapt to this. So this is a quote that came through my email as I was preparing this talk, and it was from the Harvard Museums. That says, like tiny seeds with potent power to push through tough ground and become mighty trees, we hold innate reserves of unimaginable strength. We are resilient. And so part of what I wanted to introduce today in the next couple minutes is very broadly some of what the research has shown us about resilience and risk. So one of the key points that I would like to get across in these next few minutes is that what the research has shown us is that resilience or adaptation is really the norm rather than the exception. This is some data from a study looking at job loss and depressive symptoms. And what the team found was that even up to 4 years following loss, depressive symptoms remained fairly low. And this was true for the majority of this group. 72% of the sample who had lost a job over time demonstrated low depressive symptoms. So this has generated a sort of groundswell of research in identifying what are the adaptive or the resilient factors at play in the context of adversity and loss. So we tend to think of this in two sort of bins. We think of this as things that increase risk for complications after loss, and then things that increase increased buffering or protection after loss. And in terms of the risk factors, there are sort of 5 buckets, and these are person-related factors. So these can be Hi everyone, share my screen again. Sorry for that interruption. So I'll pick up, and then consequences of the death, so loss of income. Now, we can think of these same buckets in terms of factors that reduce risk. So they're also buffering. And there are actually really hundreds of these things have been identified in the literature, and there are more coming out, and they're complex interacting network of protective factors. And they can generally fall into the same 5 bins: person-related things, traits like hardiness, having flexibility, having a broad coping repertoire. There are relationship-based factors like strong social connections, strong social support. Circumstances around the death, having an end-of-life plan in place can be protective against adverse consequences. Context of the death, lower trauma burden around the exposure or the death can be protective, not surprisingly. And then consequences of the death. So if we are able to maintain income after the death, able to maintain same living situations after the death, all these things can be protective. The second main point that I really want to convey today is that flexibility and adjustment strategies that have a person context fit drive adaptation. So just to walk you through this cycle quickly, and the main point of this is to say that there's no one coping strategy that is a fix-all. There's no one response that is perfectly protective, or no one's response that is a risk factor. Rather, it's flexibility in selecting the best coping strategy that is the best person fit that is protective. So in the stressor context, there's a process of evaluating the context and evaluating whether the fit between the context and the person, and then selecting a strategy. So we have all been exposed to hundreds of coping strategies. The mental health community, the health worker community have really mounted a formidable response into deploying information-based resources to the public on helpful coping strategies during this pandemic. The important thing is that no one is perfect. No one strategy is perfect for everyone, but it's rather selecting the strategy that's best for you in that certain situation that is most protective. And then after that strategy is selected, it's important to monitor the result. Did that work or did that not work? If it worked, then we can select a new strategy. If it did work, then that strategy can be maintained. So the main point of all this is just to say that we know that most people are resilient and do adapt to loss. We also know that there are known risk and protective factors, but there's no one protective factor that is the best strategy. What's most important is flexibility, and in selecting a strategy that is the best fit between the individual, which would be you, and the demands of the context. So I'll close with this quote. And although the world is full of suffering, it is also full of overcoming it. And I will turn it over now to Dr. Shear.
Thanks so much, Christy. And thanks for a really great presentation. We haven't known each other too long, but every time I talk with you or see you present, I learn something. So this is really, really great. Thank you. And very relevant to what I have to say, because I'm going to talk to you guys about COVID-19 loss and grief, and using the basically using all that we've learned from many years of working with the syndrome of complicated grief, which is now being called prolonged grief disorder, which is really people who are having trouble with this resilience pathway that Christy outlined. And it's really interesting how it fits in, how what she said fits into this model. It fits very well. So I'm going to talk about understanding grief, both grief first grief generically, and then something about what's happening with COVID-19. Then go to understanding how grief basically what we say is that grief emerges naturally after a loss, after an important loss, and it finds a place in our life. But that process of finding a place, which is the adaptation process, can be derailed. And then a little bit about what you can do to help adapting to loss, something about what derails the loss. So in a world of many kinds of losses, as Christy pointed out, we're going to focus today on loss of a loved one. And grief, again, is the response to loss. It's a natural response. It's also a complex response. And it's complex for a lot of reasons. It's a lot of people say all grief is complicated, and I think there are ways in which that's true. It's also permanent after a loss that's permanent, because if it's our reaction to the loss, then again, if the loss is permanent, so is grief. And as Christy pointed out, the resilience pathway is unique to every person in every context, really, I think was the implication of what she was saying. And that's true of grief too. It's true of our response to the loss. It's unique to every person, but also to every loss. Still, there are some important commonalities, which is part of what we're going to be talking about today, and how we can think about a framework for helping people. And again, all grief is complicated. I'm going to say a little bit more about that. And it's also, complicated grief is also a diagnosable condition, which is now being called prolonged grief disorder. And if you're interested, you can actually see the criteria now being proposed in DSM-5. They're on the APA website, and you can comment on them if you like. So a couple of the reasons why all grief is complicated. First of all, that it isn't just an emotion. A lot of us think of grief as an emotion, but it's really more than that. It's really a full body response, body and mind response to a loss. And there are some good reasons for that I'm not going to get into today, but it is very complex in that way. And it's also complex because it changes. It changes erratically at times in the beginning and frequently. And it also evolves over time as we adapt to the loss. It's affected by other people and by things that are unexpected and uncontrollable. So that's part of what it makes it kind of itself unpredictable and especially painful. And also it naturally contains a lot of mixed thoughts and feelings. So these are some examples of those. So most people want to hold on to their grief in a way that it's very painful, so we want it to go away, but we also want to hold on to it. There's severe mental pain, which feels like we can't possibly endure it, and yet it never seems to go away. We want to go on in our lives, we want to move forward, we want to have a meaningful life of our own, but we have little enthusiasm for that in the beginning especially. we need other people, but it's very hard to feel connected. And anyone who's read C.S. Lewis's wonderful book, A Grief Observed, he talks about this very, very eloquently, as well as all the rest of grief. It's a very eloquent description of acute grief. So we know the person died, we're perfectly aware of it, but we have trouble understanding it. And we have this, almost always have some kind of sort of disconcerting sense of disbelief that accompanies that knowledge. We crave connection to our loved one, but we also think we need to avoid reminders of them because they're reminders of the loss. And then we can't stop thinking about the person who died, but we also feel like we've lost them forever. So all of this is going on when we first lose someone. But again, grief emerges naturally and finds a place in our life. As it emerges naturally, it's usually in the form of what we call acute grief, which is characterized, broadly speaking, from a sort of 30,000-foot perspective or big picture perspective, as having very strong emotions, the core ones being yearning, longing, and sadness, and accompanied by just about any other painful emotion you can imagine, and also containing some pleasant emotions as we kind of shift our focus and start to think about the person who died. And those are very often kind of dissociated thoughts, but very pleasant ones. We also have a lot of insistent, sort of preoccupying thoughts and memories of the person who died. That's very natural. And we engage in a lot of grief-related behaviors to honor the person, to take care of various practicalities, to care for them in a sense. And we have prominent physical symptoms as well. But grief is transformed as we adapt to the loss, and our physiology is re-regulated, our thoughts and memories find a place in our life. We say that grief is integrated, and as it's integrated, it kind of quiets down and softens in the ways that are illustrated on this slide. So Bowlby, John Bowlby, those of you who are clinicians who are here certainly know who John Bowlby is, a very prominent person in the field of psychology and psychiatry. He was a psychiatrist, and he really introduced the theory of attachment, close attachments. And he wrote 3 very famous books. Among other things, he did a lot of research, and he also wrote these books. And this quote comes from his 3rd book. He wrote a book on attachment, a book on separation, and a book on loss. So this one is from loss. And he sort of talks about how we progress from acute grief to integrated grief, though that's not his language. But he talks about the need to recognize our changed circumstances. And among those things is the fact that the person who died is gone and they're not coming back. That's hard to wrap your mind around when someone first dies. We have to recognize that, as well as all the various changes that brings. Some people in the grief field call this secondary losses, but they're really circumstances of our life, various sort of mundane, ordinary circumstances. You have to mow the lawn when the person who died used to do that. You have to go shopping when the person who died used to do that, those kinds of things. And bigger things. Someone might need to get a job who wasn't working, or get a different kind of job, or someone might need to take over some major kinds of things. And also, we often need to revise our thinking about the future, which Bowlby talks about as redefinition of our life goals. And he points out that someone who is grieving, who doesn't progress in this way, remains in what he called a state of suspended life, in which they're held prisoner by a dilemma they can't solve. And that's a really good description of what we mean by prolonged grief disorder. I'm not going to say too much more about that today, but a little more, I guess. We kind of reframed what Bowlby said to talk about what it takes to adapt to a loss. And basically, we talk about it as having 2 main sort of thrusts. One is we have to accept the reality of what's happened. And that means accepting the permanence of both loss and grief, accept our changed circumstances, whatever variety and however extensive or not extensive those may be, and also a changed relationship with the person who died. This means that we have to basically alter our internalized representational models, which is part of what Bowlby talked about is the attachment system in the brain, which is kind of biologically sort of present, and which we're not talking too much about today, but it's very, very important in thinking about grief. And then we need to restore well-being. And we have used the Dichi and Ryan's self-determination theory because it's also a strongly evidence-based kind of model of what it takes to have a sense of well-being in the world, to flourish and have a sense of well-being. And basically what they talk about is autonomy, competence, and relatedness, defined as they are on this slide. So I think visually a lot of times, and I've drawn a lot of grief maps over the years, but this is the most current one. And I think it, sorry, I didn't mean to change that quickly. Let's see, just want to do one thing here. So basically what this says is that a loss triggers what's supposed to illustrate a very tumultuous, profound and difficult kind of, it sort of thrusts us into a landscape like that, which we call acute grief. And it has, remember, those intense emotions that are kind of coming and going and different combinations, along with a lot of thoughts and memories of the person who died, and a lot of sort of physiologic changes in our social behaviors. And also, it triggers also an adaptational process, which again, Christy mentioned, really her whole talk is about how natural that is as well. So when something bad happens, or when something changes really bad or good, we have to adapt to those changes, and we do that very naturally. And in this case, we're predisposed to accept the reality and restore well-being. And as we do that, grief quiets down and it becomes integrated into our life in a way that very often actually ends up helping us learn and grow in a kind of way that you might call similar to post-traumatic growth for PTSD. But what's important is adaptation can be derailed. And really, this slide should have, along with acute grief, a little notation that there are derailers, and they're derailers for all of us. The derailers are present. I'm going to talk about them in a minute. They're present naturally, but the problem comes when they gain a foothold. And when they do that, they basically block one or both of these processes of adapting to the loss. So what are these derailers? Well, they're protest and proximity seeking, which those of you who know attachment theory know that that's pretty automatic. When you lose someone you love, that you want to kind of say, no, this shouldn't have happened. I didn't want this to happen. Make it not have happened, protest it. And you also really naturally sort of search for the person. And this occurs, again, very automatically. So people will think they see the person walking down the street, or they'll just have those, they'll find themselves sort of yearning and longing and searching for the person. A really good description of this is in Joan Didion's book that you might have read, The Year of Magical Thinking. She's again a beautiful writer who describes acute grief beautifully and this part of it. And then also it's very natural to have guilt and anger, including survivor guilt. This comes from our caregiver side, because all attachment relationships, all close relationships, we get from other people feelings of a safe haven and a secure base, and we also provide those to others. And so when someone we love dies, we automatically feel some sense of responsibility. We call this sometimes caregiver self-blame, and that's pretty universal. You know, almost all of us think of something we could have done differently or said differently, or in some way made things better maybe even stop the death. And or a kind of mother lion type anger that comes from that same kind of place, that, you know, other people, the slightest thing that someone else might have done that wasn't the best, what we think wasn't the best, we might be very angry with them. And then there's also survivor guilt, which is another thing that virtually everyone feels. People even feel this when they hardly know the person. Just learning about the death of someone can make us feel uncomfortable about being okay ourselves, and especially about moving forward in life for someone who's bereaved. Another very interesting way that we can get derailed is through counterfactual thinking, which some of you may know is something that virtually everyone does. It's very automatic. When a goal is blocked, it's a human capacity, and it's very adaptive in many circumstances. It's not particularly adaptive when something happens, something very unwanted happens that is not changeable, but we do it anyway. So this is the kind of if only thinking that is, again, virtually universal. If only I had told, you know, if only I had told my my loved one in the COVID situation not to go out to the grocery store that day when they seem to have gotten the virus. If only, you know, you can think of, especially when a death happens suddenly and unexpectedly, we can all think of 100 different things that could have made that go differently. So that happens very naturally, and we do have to be able to set that aside. And then we have this, what your colleague Dan Gilbert and Timothy Wilson, who he works with, social psychologists. Dan is a social psychologist at Harvard, and his colleague Timothy Wilson have called immune neglect, is the fact that it's really kind of, again, related to what Christy was saying, that we have within us a natural adaptive, psychological adaptive system that comes into play whenever something happens that we don't like, again, or that really something happens that threatens our psychological well-being. We have a kind of implicit as well as explicit mechanisms that kick in automatically that help us kind of adapt in a positive way to that. And sometimes we don't know that exists. A lot of people don't know that exists, or don't believe in it, don't have faith in it. And so they start to think, I'm never going to be better. They start to go down a road that doesn't help. It kind of can derail the process of adapting. And lastly, we all need to find some balance between pain of the loss, which can be very extreme, but needs to be kind of worked through, and avoidance of that pain and confrontation with it. So we have to find some balance of that. So a lot of people who get kind of stuck or who get derailed from the adaptive process have found that excessive avoidance is their only way of dealing with the pain of the loss, and that doesn't usually work out too well. So there are a number of risk factors that can enhance the likelihood that these derailers can take over. And these are the same ones that Christy talked about as also having some protective factors, but person-related risk factors for the likelihood of derailers taking over are things like a past history of depression or a current history of depression, or any past history of a mental disorder can do that. An early history of insecure attachment is a risk factor, person-related. The relationship with the person who died, it's usually a very, very special identity-defining relationship, and one that is extremely central and important in the person's life. And so that's a kind of a risk factor. The circumstances of the death are big risk factors, so that we know that any death of someone young, any death that occurs violently, suddenly and violently, those kinds of circumstances, any death that occurs under questionable circumstances, will increase the chances of those sort of counterfactual thoughts, of the anger and the guilt and all of that, and make it harder to sort of set it aside. And the context of the death, when there are other things that are going on that are distracting or also require attention, that are stressful and or distracting, that can also make it more difficult to adapt and actually increase the likelihood of derailers and consequences of the death that are severe, like losing income or losing. We've seen people who've actually lost their home because of the death, or anything that really importantly directly affects the person's life can predispose to derailers. So COVID-19 is full of these, right? So I'm not going to talk about them too much because I want to make sure that we get to a little bit about how we can help and also plenty of time for questions. So this slide, though, which you will get, lists some of the ones that are obviously present. These are just examples, and you can probably think of more because there are so many things about this particular situation that we're in that are likely to increase the difficulty of adapting to the loss. So let's talk about how clinicians can help COVID-19 bereaved people, and actually how people can help themselves, or how supportive others can help too, because we all need to be engaged in this effort. So the first thing is that I'm going to focus primarily on clinicians. We can talk later about how this relates to other people if you want. But so for a clinician, active empathic listening, of course, is always important. Basically, it's always important in any of the work we do, but it's especially important when supporting a bereaved person. And it's a sort of corollary of that is that we need to be listening. We do need sometimes to be supporting, guiding, and validating, but we do not need to give advice, because for the most part, guiding is a little bit like advice, but we do it in a much more gentle, not too advice-giving way, because people who are bereaved are grieving in their own way. They have their own unique ways of grieving and their own unique ways of adapting. And they kind of intuitively know that when other people try to get them to do what the other person thinks is that they're supposed to do, it's not helpful, and it often creates a lot of pushback and sort of resentment, which we don't. You can find that all over the place in grief and the internet. We don't want to do that. An important thing about COVID-19 is that people may need to sideline their grief, because right now we all need to take care of ourselves, and often to take care of others as well. And that is the highest priority. And there are other situations where this is true as well. So it's not essential for the kind of best adaptive processes to occur right away. They don't necessarily occur right away. And people do sideline grief. Sometimes it's hard to do that, and some people can't do that, and that's okay too. I mean, there aren't any rules about this, but for people who want to sideline it, it's important to realize that they might need to do that. And also because the unavailability of the physical presence of supportive friends and families is important. That doesn't mean we can't support people digitally. We're all doing that, and I think it's extremely important to do it, but it's not the same, because importantly, it's not the same because we don't get the same information transfer non-verbally on these, Zoom or Facebook or whatever we're using. And because also physical touch has physiologic and emotion regulating effects, so that it is also important. But in any case, so it makes sense for people to sort of postpone their grief, and that's fine. It also may worry people, because there's a lot out there that says you have to go through your pain, not around it. You have to experience the pain of grief, and and so if they are sidelining it, if they are putting it aside, that may make them feel like they're not grieving in the right way. So you can help them with that. Help them really find that balance between allowing the grief or experiencing the grief if it's coming and they can't really stop it, which can happen, and also taking care of their own life and the people that they still need to help take care of, children or whoever. And then also clinicians should be screening and treating those with mental disorders, some of which may have been pre-existing and sort of continuous, some of which may recur in the stress of the COVID epidemic, some of which may emerge as a consequence of the pandemic. Also, suicidal ideation and behaviors are important and obviously need to be attended to, and any worsening of medical conditions. So other ways, though, that clinicians can help are based on the work that, these recommendations are based on the work that we've done for many years. And these are things that help people with acute grief and also people with prolonged grief disorder or complicated grief. So the first thing is that most people don't really understand grief and don't, they either want it to be there all the time, like I said before, or they want it to go away. So understanding it and accepting it as it is one of the important things we can help people do. We can help them manage their emotional pain. Most clinicians have skill in doing that in various different kinds of situations, and you can use those kinds of skills in this one as well. You want to start to help people see some possibility of a promising future. This is a little counterintuitive to grieving people and to clinicians and other people early on, but just looking for opportunities to a little bit gently remind people that there is a future, that there can be a future, that happiness is possible even though this person is gone. You have to be not heavy-handed about that at all. So just a few more of these things, and I'm not going to talk too much about them here. You'll have them on the slides, and we can also talk about them in the Q&A session if you want. But definitely strengthening relationships with others can be helpful. And of course, in this current situation, that can be challenging just in and of itself because of the need for physical distancing. And there's a lot of recommendation to be doing this just generally, but certainly for bereaved people, it can be even harder. There's a real inclination that bereaved people have to pull back and sort of turn inward, but they also do much better. We don't really grieve well alone. So we need those people around us. And that may mean kind of helping, really encouraging them to reach out a little bit in this situation, or hopefully the public will, and friends and family will do that very naturally. I think they really will in the ways that we can. It's usually helpful for the person to tell the story of the death, to be invited to tell the story of the death, not pushed to tell it, but invited to tell it, because doing that, sharing that story, and sort of being alert to what troubling aspects they might need to really talk about and think through can be enormously helpful to people. Actually, it's something that if you go to, visit people who've recently lost someone, if you go to a group sort of session, comfort session, visitation, whatever you want to call it, this often goes on very naturally. People will say what happened, person will tell the story, usually over and over, and it can be quite helpful. And then lastly, we want to help people learn to live with the reminders. So there's a lot of inclination to avoid things. And of course, in the COVID situation, we're being told to avoid just about everything outside of our home, but inside the home, there may be reminders, and it may be very helpful for people to avoid them somewhat, especially in the beginning, but just to make some kind of a decision, let's say, that eventually they're not going to solve this problem of living without the person they love by avoiding as much as they can of what reminds them of that loss, because there are many reasons to learn to live with those reminders instead. And lastly, helping people to feel a sense of connection to the memories of the deceased person. And that really is going to happen very naturally as the person understands and accepts the death itself. So I'm going to end at this point. So what we've said is that grief emerges naturally after an important loss, that we adapt naturally to even the most difficult losses, as Christy beautifully pointed out, and that supportive companions are very important, as well as clinicians who probably are going to be asked to help with many of these COVID-19 deaths, because they have so many elements that are likely to be especially challenging. So I'll stop here and thank you for your attention. we'll open it to questions.
Thank you so
Thank you,
much.
Kathy and Christy, for this very timely talk, highlighting the spectrum of losses facing us and also reminding us of the adaptation and resilience accessible to us. I'm going to hand it over to Dr. Bizu Gelaye to get us started on some of the many questions that are coming in.
Thank you, Dr. Basu. Well, we have a lot of questions and we have over 700 participants.
Wow.
Obviously, we can't address all questions, so I'll try to pick a couple of questions and have you an opportunity to address. We also have other panelists, including Dr. Karestan Koenen, who might be able to join in answering some of those questions. So the first one is, Kathy, you've talked about coping and adapting, and there's this question that for people, if they adapt too quickly and they don't give themselves to have a chance to grieve in, do they fit into some over-functioning?
So that's a great question. I think what the person is referring to is not, I wouldn't call it adapting by definition almost, and you know, because adapting means that you really have accepted the reality, and that's a complex process, and you can't do it too quickly, actually, because our brains can't really fully comprehend what it means to lose someone fully without living for a while, because you know, you can sit in a chair and think about it, or you can try doing other things. Like, I think that what this person is saying is being very actively re-engaging in life without you know, without really kind of coming to terms with the reality of the loss, I think, and kind of sidelining that again. And yes, I think so. That's something that I would say the jury is still a little bit out about that in general. But in the COVID situation, what I was saying is that there is some benefit, there could be some benefit and some need even to do that because of all that's going on around us, which includes, of course, physically taking care of ourselves and other people, but also might include, you know, trying to figure out how you're going to make a living if you're also unemployed, or, you know, how you're going to deal with all of the various things that are happening. And so it might not be the best time to try to come to terms with that, but you're absolutely right. Eventually, you know, we do need to do that, or it can take a toll.
Yeah, this is also, I guess, my question as well. You know, at this time of pandemic, many survivors will not be able to celebrate customary funeral ceremonies. How can we help clients accept this change of cultural strategy in adapting the process of grief?
So do you want me? I have an answer to that, and then maybe someone else will also have an answer, because that's another great question. It's such an important question. But I'll tell you the way that I'm going to answer this is that I actually love the serenity prayer. And what that tells us, of course, is that we need to accept the things we can't change. And that's one of those things we cannot change. We cannot change the fact that we cannot have usual funerals right now. So then the other piece of it is that we're instructed to have the courage, or whatever, to, I think it's courage and creativity and whatever else we bring ourselves to bear in changing what we can. And what we can change is how we decide to honor and memorialize the person now, and also perhaps plan for the time when we know this pandemic will be over and we will be able to once again have our celebrations, our cultural celebrations, our funerals, our whatever. So I think the main thing is to get straight, you know, what can we change, and not spend a lot of time, you know, basically worrying about that, and try and creatively problem solve, which I think we're well able to do, as Christy pointed out.
Christy, do you have anything else to add?
Only in that on the creative problem solving note is, and Kathy and I have been talking about this as we prepared this talk, is the role of having an Archana as well on having end of life conversations with loved ones. Now, this is a task which many of us face with a great avoidance, myself included, and our loved ones also. These are very difficult conversations to have, but they can, and people have different tolerance and capacity for having these. So there's a sensitivity in this, but there is some literature and research showing that these things can buffer against some downstream adverse outcomes after loss. Now, it's not going to solve a problem, but it is something that we can do now in a time when there's not much we can do besides accept the reality. And so this is one area of a little bit of give for some creative problem solving.
Thank you. Maybe I could pose this question to Archana as well. Is the treatment the same for children? Are there other suggested strategies for children?
You're still muted.
You're muted, Archana. You need to unmute yourself.
Okay, sorry about that. I would say actually conceptually the principles are very much the same. And we actually, as Christy highlighted, talk about children's capacity to adapt and adjust and show resilience in our conversations with patients and families. And we highlight many of the same protective factors that Kathy highlighted around the capacity to support children within other relationships, helping them understand at a level that is developmentally appropriate for them what loss might mean. So for example, with young kids, they're developmentally speaking, their understanding of loss or death is pretty different. And so we try to frame the same principles in enabling them to talk about their feelings and their experience of loss in sort of age-appropriate ways. And then highlighting the ways in which they may, as a family, be able to come together in different ways than they traditionally would, in exactly the ways that Kathy and Christy highlighted, to celebrate maybe the memories of the loved ones, but also to think about ways to plan for rituals when that is more accessible or possible. But I do think that one of the most common questions that comes up from parents is whether they should say something to the kids, and if so, how. And I would say that being able to talk about it within a supported relational environment is definitely shown to be very helpful, primarily because we don't want kids to feel alone in their worries or confusions or feelings of loss and sadness.
Bizu, could I just add two brief things to that? Because that was a great, that was so helpful. The two things I want to add are that as Archana has been saying, children do grieve, but they do grieve differently than adults. They do grieve pretty differently. And so that's something that you might want to be aware of. And also the other thing I wanted to say, the reason I know this is because we made a mobile app called Grief Steps for Parents that is available if people would like to take a look at it. You can get to it through our website, which is on the resources page. But I don't treat children, so I'm really a little bit out of line. But we were asked to do this particular project, and I had to read a lot about it and study a lot about it, and that's how we put this together with some other experts.
Thank you. Thanks, Archana, Kathy. There's another question for you, Kathy. Could you talk more about survivor guilt and a sense of feeling impotent in the face of the pandemic? It seems to this participant that watching the days without being able to stop the process adds another level of trauma that can complicate our collective response to what is happening around us.
Absolutely. That's, it's so hard to deal with for everybody to deal with what we're experiencing right now. It was specifically, the question I think was about survivor guilt. And that is, I think it's a universal reaction when someone we love dies. We feel like there's just some feeling that comes up in us that we shouldn't go on with our life either. We don't deserve to live when they didn't. Especially in this situation, that's sort of true. There's no reason why anybody, it's often true, but this in particular, where we often see families infected, right? We see whole groups of people who know each other infected, and maybe only one of them dies. And that's a great thing in one sense, but in another sense, the ones left are going to be feeling, just badly about that. And you do want to watch out for that, because I would say that in general, you can kind of ask yourself the question, would the person who died want you to bring your own life to a halt because they died? I mean, the answer to that is pretty much always no. It's not always comforting enough. It's not always enough to set that aside, but whatever you have to do, I mean, it's important not to let that guide your actions for too long. I mean, in the beginning, okay, but you got to come to terms with that. And it is very, very natural. And I'm sure it's one of the things, I mean, there's so many sources of potential guilt, that people could start with self-blaming. We all will blame ourselves, if someone we love dies, for sure.
Christy, do you have anything more to add?
No, that's, yeah, beautifully said.
Is there anything that we can do in workplace to help people be prepared and have some empathy?
Someone else want to answer that? Maybe Karestan could answer that. She's still muted, so I don't know if that's a no.
Just quickly, in one thing we do have is we have a resource page on the Harvard Chan, and it will be posted broadly. There are many resources there, sort of like tips for coping. All of these forums are there, so there are some sort of general resources that can be sent around to workplaces to to bolster some support.
Yeah. Thank you. That was, I was also talking. I'm having some technical difficulties with talking.
Workplace too.
Muted. But yes, that there are some resources there, and also there are some. If people want to email us, there's some specific people who have been working on that related to their workplaces, and we're happy to send those out, that information out too.
One of the things that I will say is, in terms of workplaces, is, and I know, I work at MGH, but I know this is true in multiple settings right now, that there seems to be a very concerted effort to create sort of safe spaces in the context of working with professionals where there isn't kind of role overlap, to have ongoing conversations about the worry that we all have about potentially losing someone that we love or care for or know, because it's also the anticipatory anxiety as things are unfolding. And then I think one of the things that was highlighted in the talk by Kathy was that it's also sort of the loss of knowing the person as we experience them, in the ways that they affect us or touch our lives in a daily sense. And I think that especially for frontline workers, there's a lot of compassion and concern for them. And I think one of the things that we have done in our division, and that I know many places are doing, is to provide mental health resources, but really to establish kind of ongoing spaces where people can talk about their worries that they're having, because it really is sort of, from my perspective, an ongoing process of a loss and adjustment.
This comment, I think, this is something that we've alluded in the past, reading an article that we should start to use physical distancing rather than social distancing terminology as a way to really help us in this time. And I think, in our group, we've been trying to use the word physical distancing, not social distancing. Do you have any thoughts about this, Kathy?
I think it's a great idea. I think it's an uphill battle because, but I think it's a great idea. I think I changed, I had a few times where I was going to write social distancing, and I said to myself, no, it's physical distancing. I think it's a really good point, because we can connect in a lot of ways socially.
You know, you've talked about counterfactual thinking. So how is counterfactual thinking different from caregiver self-blame?
Okay, so caregiver self-blame is, in my view, it's an automatic response that we have because we're predisposed. So part of the attachment system, there's a caregiver system in our brain, and we're sort of predisposed to want to protect and take care of people we love. And so when someone dies, we've failed. You know, it doesn't matter how they died or where it's just, we failed, period. It's not very complex, it's very simple. Counterfactual thinking is the way that we can develop, that we're really good at developing alternative scenarios for bad things that happen or for things that we don't want to have happened. And this happens with the most trivial thing. You know, you watch a good example is a ball game of some sort, sports game that the wrong team, in your opinion, loses, and you can generate all kinds of counterfactual alternative scenarios where they might have won, or you don't do as well on an exam that you as you wanted to, and so you generate these alternative scenario. It's a whole alternative scenario, and our brains do this very naturally because it's the same mechanism in the brain that also sort of projects into the future, simulates various kinds of ways of acting in the future, which makes us, this is all what makes us so amazing as people. So that's, I think, the difference. The problem, of course, is there's upward and downward counterfactual thinking. So upward counterfactual thinking is what's the problem. That means I could imagine a scenario that was better. Downward counterfactual thinking is I could imagine a scenario that was worse. And that actually does help in grief. So, you know, at least my loved one didn't have to suffer a long drawn out illness or something. At least they didn't die in a terrorist attack. I mean, you could, or at least three other people that I love didn't die. I mean, there are ways that people will do that, and it is somewhat comforting to do that kind of alternative scenario inventing, but it's a problem. The other kind is in a way more useful for future thinking, and it's more what we tend to do in bereavement that can derail us.
Thanks, Kathy. One participant is offering this advice. What they are doing as a family is they talk amongst friends, and all of them are in frontline community health workers. So they talk about will, end of life planning, just talk and share some humor. Thanks for sharing that. I'm mindful of the time, but maybe I will ask this one last question. Just, do you have any advice for residents in senior care facilities to support people who lose a spouse, especially when people are not electronically connected?
So I could start the ball rolling, and maybe other people will answer too. But I think it's really tough. But obviously that's a really, really tough situation. And I guess the answer would be, to really try to remember what I think a lot of older people, being a somewhat older person myself, I find myself and my friends often thinking about, we often think about our lives and our death. I mean, I think it happens very naturally. And I think reminding yourself of the things that you value and have valued, and in your relationship with this person who died, and that, again, it's kind of gets back to the serenity prayer that you can't change it. And so trying to I guess feel your feelings, but also remind yourself that there are ways that that your loved one knows that you love them, and that remembering that yourself, and kind of accepting the way it happens. It's not a great answer, and also the staff, I was going to say the staff probably need to be involved also to help people, support people, even though they're not their close friends and relatives.
Christy, Archana?
Just quickly, this is such a tough situation, and my heart goes out to those facing it. And I, one quick idea is sometimes writing. If people can't communicate through phone or video or internet, Letters are an option. Mail is still being delivered, and writing can actually be quite there. It depends. I'm a big journaler myself. Writing can be very therapeutic. Of course, it depends on the situation. It's not therapeutic for everyone, and not therapeutic in all situations. So be mindful as you're doing it that it's helping or not. But it can be a way to communicate and at least express things to someone who we couldn't speak to through the internet or by the phone.
Thanks. Anything, Archana, Karestan?
I think just building on the points that were made, some of the ways in which we've talked to some families recently are around working with workers in the facilities to really think about kind of essentially if in retelling the story, what would you want for that family member? What do you imagine that family member might want? Parenting, and also taking care of our parents or grandparents, it's a very visceral experience. It's very physical. And so it is in fact a really unfortunate loss, and technology can be limited in these contexts. But if, to think about what our family members might want, and then working with kind of the workers in the facilities to enable as much of the comfort that one might want to provide, has been kind of the primary focus that we've had.
Thanks, everyone. I just wanted to thank our panelists for this really terrific panel, and also say that our next forum, which will be next Wednesday at the same time at 11, will be on a very valuable topic that is on sleep and improving and dealing with sleep problems or sleep challenges during this very stressful time. And we'll have Don Posner, who's an expert in sleep. So I'm looking forward to that myself. All the materials, Shaylee did put them in the chat, but all the materials are available online. If you have any problems getting them, just email us. We can get you the materials, but everything is available and for the public. And thank you so much.
Thanks, everyone.
Thanks, everyone. Thanks, Kathy.
Thank you, everyone.
That was
Thank
great.
you, our moderators and hosts.
Yeah.